Welcome to the deep dive, where we really try to extract the crucial knowledge you need from, well, often a mountain of information. If you're currently sifting through your notes trying to nail down those key concepts, you are definitely in the right place.
Exactly. We're here to try and give you the essential insights and, pretty fast. Today, our focus is sharp, silicosis.
Right.
We've been digging into some detailed MSRA revision notes, that's the multi-specialty recruitment assessment notes, to bring you the really high-yield facts on this important occupational lung disease.
Okay, so our mission today is pretty simple. Give you a clear, memorable overview of silicosis. We'll cover what it is, how it happens, how you might spot it, and what can be done.
And we'll sprinkle in some memory aids, too, and maybe some example questions to help it stick for revision.
Perfect. Okay, let's dive in then. What exactly is silicosis?
Right. So at its heart, silicosis is a fibrosing lung disease. The critical point, really, is its cause.
Here.
Breathing in these tiny crystalline silica particles, silicon dioxide?
Silica.
Yeah. And when these microscopic particles get lodged in the lungs, they set off inflammation. This leads to fibrosis developing and eventually scarring of the lung tissue itself.
So it's like the body trying to react, but it causes damage?
Precisely. It's this sort of runaway inflammatory cycle triggered by the silica.
Hmm.
The body's attempt to clear the particles actually ends up causing the scarring.
So this isn't something that just resolves on its own then?
No, absolutely not. It's a progressive and irreversible process. This scar tissue builds up, makes the lungs stiffer, harder to breathe, and just generally reduces lung function.
Okay.
Oh, and we should probably quickly mention Kaplan's syndrome as well.
Yes. What's that?
That's specifically pulmonary fibrosis seen in coal miners who also have rheumatoid arthritis, a specific subtype, sort of.
Got it. So we know what it is, what it does. Now, what actually puts someone at risk? What's the etiology, the cause?
Well, the main culprit is long-term exposure to silica dust. Simple as that, really.
From work, usually.
Yes, think about professions where you're breathing in dust containing that crystalline silica regularly. Mining, quarrying, construction.
Sandblasting, I've heard that's bad.
Sandblasting, definitely. Stonemasonry, too. They all carry a significant risk.
And is the repeated breathing in of these tiny bits that starts it all off?
Exactly that. When these particles, mainly quartz, get inhaled over time, they stimulate the formation of those characteristic fibrotic nodules in the lungs.
Nodules.
Yeah. And the really crucial bits here are the amount of dust, the intensity, and the length of time someone's exposed, the duration.
Right. Makes sense. Intensity and duration.
Mhm.
So prolonged exposure is key. Are there other things that, increase the risk? What are the main risk factors?
Well, number one is definitely that occupational exposure we just talked about, but the danger gets amplified if there aren't good safety measures in place.
Like masks and things.
Exactly. Inadequate respiratory protection or working where there are just really high levels of silica dust makes it much more likely.
And what about individual factors? Does health play a part?
Yes, it does. Some people are more vulnerable. Smokers, for instance,
Yeah.
and anyone with pre-existing lung conditions, they face a higher risk too.
Go ahead.
And just to reiterate, those high-risk jobs, mining, working with slate, foundries, potteries, classic examples.
Right.
And thinking back to Kaplan's syndrome again, that combination of rheumatoid arthritis, RA, and coal dust exposure is critical, especially in anthracite coal miners or those also exposed to silica or asbestos.
So it's a specific overlap there.
Yeah, and there might even be a genetic link for some people, and smoking definitely makes everything worse. It aggravates the problem.
Got it. Okay. Exposure, risk factors covered. What's actually happening down at the, the cellular level, the pathophysiology?
So when those silica particles get inhaled, the first thing that happens is the lungs get inflamed.
Okay.
The immune system kicks in, sends macrophages. They're a type of immune cell to try and sort of engulf and get rid of these foreign particles.
Which sounds like what the body should do.
Initially, yes. But when the exposure is continuous, long-term, this whole process gets, disrupted. The normal control, the regulation of the immune response, goes a bit haywire. And this dysregulation leads to the release of all sorts of inflammatory mediators, chemical signals that just promote more inflammation.
Right.
These mediators then pull in fibroblasts. Those are the cells that make connective tissue. And the end result is those fibrotic nodules we mentioned and this progressive scarring of the lung tissue.
So it snowballs.
Pretty much. And ultimately, it's that scarring that stops the lungs from working properly.
So it's the body's own defense system causing the long-term damage inadvertently. Now, if someone comes in with these kinds of lung problems, What else might be going on? What's the differential diagnosis?
That's a really important question. You've got to consider other occupational lung diseases, the pneumoconiosis, things like coal workers' pneumoconiosis, asbestosis. They also come from dust inhalation.
Okay, other dust
All
diseases.
right, exactly. Then you've got more common respiratory conditions that can look similar, symptom-wise. COPD, chronic obstructive pulmonary disease, is a big one. Even tuberculosis, TB.
So how do you start to sort that out? Distinguish between them?
Well, a really thorough evaluation is crucial, and the absolute key, honestly, is a detailed occupational history.
Back to the work history.
Always. What jobs have they done? What were they exposed to? For Kaplan syndrome, it's quite specific.
Yeah.
You need the RA diagnosis plus that history of coal dust exposure.
Right.
We also have to remember that silicosis and asbestosis can sometimes, overlap or present similarly. And like you touched on, the chest x-ray in silicosis can sometimes look a bit like TB.
Tricky.
It can be. And another thing, rheumatoid arthritis itself can cause lung problems even without any dust exposure.
Really? Like what?
Things like interstitial fibrosis, fluid around the lungs, pleural effusion, nodules, inflammation of the lung, blood vessels, arteritis, and even pulmonary hypertension. So RA lung disease is a differential in itself.
Wow, okay. So the context, especially the work history, is absolutely vital. Now, how common is silicosis these days? What's the epidemiology like?
Well, looking at the UK specifically, it's actually relatively uncommon now as an occupational lung disease.
That's good news.
It is, though finding precise, really up-to-date numbers specifically for the UK is, well, it's not easy. Generally, though, in developed countries, the rates have dropped.
Why is that?
Mostly down to much better workplace safety rules and practices. And of course, the decline of industries like coal mining has played a big part too.
Right.
So the overall prevalence is pretty low now. A lot of what you read in medical literature tends to be individual case reports rather than big studies.
So less research happening too.
Somewhat limited, yes.
Yeah.
Fewer than, say, 20 papers specifically on silicosis on PubMed in the last decade or so.
Okay. So it shows that better safety works. Now, what are the actual signs and symptoms? If someone has it, what might a doctor see or what might the patient report? Clinical features.
Yeah, how it presents can really vary. It depends a lot on how intense the silica exposure was and for how long. And a key thing is that symptoms can take years, even decades, to show up.
Decades. Wow.
Yeah. In the early stages, common things are maybe a persistent cough, shortness of breath dyspnea, maybe some chest pain, feeling tired, losing weight without trying, and getting more chest infection.
Okay, quite general symptoms initially.
They can be. But if the condition progresses,
What happens then?
in more advanced stages, you can see much more serious problems. Things like respiratory failure, the lungs just can't get enough oxygen in, and cor pulmonale,
What's that again?
that's right-sided heart failure, specifically caused by the strain the lung disease puts on the heart.
No.
And if we're thinking about Kaplan syndrome, then you'll also see the rheumatoid arthritis symptoms playing out. Painful joints, stiffness in the morning, tender, swollen knuckles, the MCP joints.
Right, the RA signs.
Exactly. And interestingly, with Kaplan's, people might even have rheumatoid nodules, those lumps under the skin, sometimes years before the actual RA diagnosis is clear.
Huh. And what might a doctor find on examination? Listening to the chest.
They might hear diffuse rails crackling sounds in the lungs, and typically these sounds don't clear, they persist, even if the patient coughs or takes a really deep breath.
Okay. So breathing problems plus that exposure history, major clues. How do you actually confirm it? What are the key investigations?
Right, diagnosis. The absolute first, most crucial step is getting that detailed occupational history. Cannot stress that enough.
Documenting the exposure.
Thoroughly. Past jobs, present jobs, any specific silica dust exposure. After that, imaging. A chest x-ray, CXR, is usually the first port of call.
And what are you looking for on the CXR?
In silicosis, you might see multiple, round, quite well-defined nodules, typically maybe 0.5 centimeter to 2 centimeters across. And sometimes these nodules can cavitate, develop hollow spaces inside.
Which can look like.
Which can mimic TB, like we said.
Right. And if the x-ray suggests silicosis.
Then often the next step is a high-resolution computed tomography scan and HRCT of the chest.
That gives a better look.
Much more detailed picture, yeah. You can see any cavitation much more clearly and really assess the extent of the lung damage.
Okay. What else? Breathing tests?
Absolutely. Pulmonary function tests, spirometry, are vital. They often show a mixed picture, partly restrictive, partly obstructive lung defect. You might see reduced overall lung volume, airflow limitation that doesn't reverse with bronchodilators, and a reduced gas transfer factor.
Meaning the oxygen isn't getting across properly.
Exactly, the lungs aren't doing that gas exchange efficiently.
Any other tests?
Well, sometimes sputum or bronchoalveolar lavage fluid analysis might be done washing out some cells to look at them. And in certain cases, for a really definitive diagnosis, a biopsy or bronchoscopy might be needed, taking a small lung tissue sample.
Are there any sort of classic findings on these tests that really point towards silicosis?
Yeah, a couple of things are quite suggestive. Seeing that pattern of fibrosing lung disease on the imaging, combined with something called eggshell calcification of the hilar lymph nodes.
Eggshell calcification.
Yeah, it's quite specific. The lymph nodes right in the center of the chest get this thin layer of calcium around their edge. Looks like an eggshell on the X-ray or CT.
Ah, I see. Very specific.
It is. We might also do some additional blood tests, looking for things like rheumatoid factor, antinuclear antibodies, other nonspecific antibodies. Also checking inflammatory markers like ESR, plasma viscosity, CRP, see if they're elevated.
And if there are joint symptoms?
Then X-rays of the affected joints might be done, looking for those typical bone erosions you see in rheumatoid arthritis.
Okay, quite a comprehensive workup. So once someone is diagnosed, what can actually be done? What's the management plan?
Right. Management, the absolute cornerstone here is preventive measures.
Stopping it getting worse.
Exactly. The most critical thing is preventing any further exposure to silica dust. That means strict occupational safety stuff, good ventilation, making sure people wear their PPE, like respirators, consistently, and regular health checks for workers in those high-risk jobs.
So stop the exposure, number one. What about treating the damage that's already there?
Well, the main focus becomes supportive care. It's about alleviating symptoms, managing complications, so that might mean using bronchodilators to help open the airways.
Like inhalers?
Yeah, providing oxygen therapy if their levels are low, treating any infections promptly, basically managing the consequences.
Is there anything more drastic?
In really severe cases where the lung damage is just extensive and debilitating, lung transplantation might be an option, but that's a last resort, obviously.
Understandable. Any non-drug approaches?
Yes, especially thinking about Kaplan's or RA-related issues, immediate stopping of any coal dust exposure is vital. They'd likely need physiotherapy, similar to how you'd manage RA generally, and absolutely crucial, quitting smoking. Strongly advised for anyone with silicosis or at risk.
Makes sense. And medications? Any drugs help?
Steroids, corticosteroids, might be used sometimes, but usually only after you've definitely ruled out active TB, because steroids can make TB worse.
Right. Caution needed.
Yeah. And for people with Kaplan's who have early-stage RA, they might be started on DMARD's disease-modifying anti-rheumatic drugs to manage the arthritis component.
Okay. So it's mainly about slowing things down, managing symptoms, rather than a cure. What's the long-term picture then? The prognosis?
Yeah, the prognosis really depends heavily on how severe the lung damage is when it's diagnosed, and crucially, whether that person can completely stop any further silica exposure.
So stopping exposure really can make a difference.
It really can. Early diagnosis and strict exposure control can often slow down the progression, maybe even halt it in some cases.
But if it's advanced?
If it's already advanced, then unfortunately that irreversible fibrosis and the breathing impairment can significantly affect quality of life and life expectancy too.
So catching it early is key.
Absolutely. Timely diagnosis, good management, and most importantly, effective prevention in the first place. That's what leads to better outcomes. And like managing RA, avoiding other things that can harm the lungs is important too.
Is severe disability common?
Severe respiratory disability isn't always the outcome, but if someone develops what's called progressive massive fibrosis, that can certainly progress. Spontaneous remission, the lung disease just getting better on its own, is theoretically possible, but likely very rare, not the typical path.
Right. Prevention is definitely the best medicine here.
Yeah.
What are the main things that can go wrong? The complications?
Unfortunately, there are several potential complications. The lung fibrosis can just keep getting progressively worse, eventually leading to respiratory failure.
Okay.
People with silicosis are also more susceptible to chest infections, particularly tuberculosis, as we mentioned.
The TB link again?
Yes.
Yes.
Cor pulmonale, that right-sided heart failure, can develop because of the strain on the heart. And there's also, sadly, a higher risk of developing lung cancer and other lung conditions alongside it.
So keeping a close eye on things is vital.
Absolutely. Regular monitoring, sticking really strictly to those preventive measures, it's all essential to try and catch complications early and manage them. Prompt intervention is key.
And being careful with treatments, too.
Yes, always mindful of potential side effects from things like steroids, NSAIDs, or DMARDs if they're being used.
This has been incredibly useful, a real deep dive. To help everyone listening really lock this in, maybe we can go over those memory tips and example questions again.
Excellent idea. Let's consolidate. So, for remembering the risk factors, you could try the mnemonic some workers are at risk.
Yeah,
Smoking, occupational exposure, mining as a key example, exposure, intensity, dehydration, and underlying lung diseases.
some. That's good. I like that.
Yeah.
Okay, and an example question testing, say, causes and initial tests.
How about this? A 55-year-old former sandblaster presents with progressive shortness of breath and a chronic cough. What is the most likely underlying condition and what initial investigation would be most informative?
Okay, so likely condition is silicosis, right?
Yeah.
And the initial investigation. That detailed occupational history first, then the chest x-ray.
Spot on. You got it.
Great. Now, what about remember the investigations? Any tips?
You could think ROS in the lungs.
RAS.
Radiology, CXR-HRCT, occupational history, clinical features, knowledge of PFTs, pulmonary function tests, and sputum biopsy.
RAS in the lungs. Very memorable. And a question for that.
Maybe. Describe the typical findings on a chest x-ray of a patient with silicosis.
And the answer would be those multiple, round, well-defined nodules, maybe cavitation.
Exactly, and potentially that eggshell calcification if you want to be thorough.
Right. Okay, finally, complications. How do we remember those?
Try thinking FIRCL, F-I-R-C-L.
FIRCL, what's that stand for?
Fibrosis, progressive, respiratory failure, core pulmonale, and lung cancer infections.
FIRCL. Got it. And a question.
Simple one. What are some of the major complications associated with long-standing silicosis? And you'd list those things from FIRCL.
Perfect. Those mnemonics are really helpful.
Good. So, just to wrap it all up, silicosis, it's that fibrosing lung disease from breathing in crystalline silica. Mainly affects people through occupational exposure, often over long periods.
Progressive, irreversible.
Exactly. Inflammation, scarring, leading to breathing problems. Diagnosis relies heavily on that occupational history, plus imaging like CXR and HRCT and lung function tests.
And management.
Focuses on stopping any more exposure, number one. Then supportive care for symptoms and managing those complications we talked about, the first CL ones.
So early identification and prevention, especially at work, are just critical.
Absolutely critical for better outcomes.
Definitely key points to remember. Make sure as you revise, you go back through your notes on silicosis. Think about how this information might come up in questions. And for more really valuable resources to help with your MSRA revision, do check out pastthemsra.com and also freemsra.com.
Great resources there.
Thanks so much for taking this deep dive into silicosis with us today.
My pleasure. Always remember, understanding the why, the mechanisms, and the whole clinical picture is really key to mastering these conditions. Keep exploring, keep learning.